Thanks for joining us. We hope to share a message today that you find helpful. Before we get into the message today, let me introduce myself. I've met many in the community, but not everyone. My name is Matt Schaefer. I'm the President and CEO here at East Tennessee Children's Hospital. And Dr. Joe Childs, who many of you likely know and or have seen throughout the pandemic, is with me today. And we want to have a different discussion with you today. There is so much information for you to consume. What's happening in the environment around us? What's going on with COVID-19? What is the Delta variant? How is it affecting children differently? And today, as we talk to you, we want to simplify some of that. We want to share some messages about what's going on here at Children's Hospital, what we're seeing, so that you have the most accurate and up-to-date information. And as we do that today, I do that as a father of two girls. I have a 12-year-old and a 14-year-old. They're in the Knox County school system. And I have interest in making sure that I, as a parent, have good information. And one of our responsibility here at Children's Hospital is to make sure that you, the public, parents, moms and dads, guardians, have the best possible information on which to base your decisions. What we are going to focus on 5 specific topics. And I'll have a conversation with Dr. Childs as we go through those topics today. And I would just note that the topics we talk about today, and as you would expect in a COVID-19 message, this is the information as we know of it today. It's changed prior to this. It'll likely change tomorrow. And our commitment to you, as it has been throughout the pandemic, is to keep you as well informed as we can about those changes. You know, as a pediatric healthcare institution, one of our core responsibilities is to make sure that we're in a position of inviting families in as our partner. When you choose Children's Hospital, you inherently choose a group of experts who understand that mom or dad, guardian, is in the driver's seat of their child's health. So when we share this message to you today, we inherently understand that. That is part of what we do every day, and COVID-19 is no different than that. So with that as an intro, I want to bring Dr. Childs into the conversation. And Dr. Childs, one of the first things I think that's on many people's mind is what's going on the ground? What's the situational update here at Children's Hospital?
There's a lot of rumors out there about what is going on, so it's great to have the opportunity to really share the facts. We have been busier with COVID than at any other time during the pandemic, and that's true for a lot of children's hospitals, especially in the South, where this surge with the Delta variant is hitting hardest. Over the last week, we've had 24 admissions to the hospital with COVID. Presently, we have 9 patients in the hospital as we started the day today. We've had as many as 14 at a time. We've kind of been fluctuating 7 to 10 patients per day. We've had up to 5 in the ICU at one time. We've had up to 4 on a ventilator at one time. But the good news is these patients have done well. And presently, we have just 1 in the ICU, nobody on the ventilator. And we like the trend where things are staying stable with those particular numbers. So that's kind of the hospital admission look, but the story is not so much about hospitalized patients when it comes to the children in our community. It's a lot of kids that are getting the virus and having symptoms. And we've said throughout the pandemic that this virus doesn't tend to make kids very sick. And the good news is that's still true. What we're seeing right now in the hospital is because so many kids have the virus, and if a lot of kids get it, there's going to be a select few that get sick enough or fragile enough that they need to be in the hospital. So the outpatient areas, the clinics, the urgent cares, the emergency room, they are busy. A lot of patients have been coming in with respiratory symptoms. A lot of those do have this particular virus. But the good news out of all those is not that many do need to be in the hospital.
You and I have the benefit of seeing the whole picture. This morning here at Children's Hospital, there were approximately 122 inpatients. So across our entire institution, 122 families are disrupted with their child one of their most prized possessions being here at Children's, 9 of which here for COVID-related illness, and the remainder of which not related to COVID illness. So we've talked about situational update. We hear a lot, I hear a lot in the community, Delta is different. What does that mean, Dr. Childs? How, as a mom or dad, do I understand the phrase Delta is different?
Well, I think the one way we definitely know it's different is it is at least twice as contagious as the previous variant. Predominantly, that was the Alpha variant. It may be even more contagious than that. And so it's much easier for transmission from person to person. So the things that we had kind of gotten lax about doing, whether it be masking in indoor public places, keeping distance, hand washing, it's much more important now, and and even that, it may not be as effective because it's just a very contagious airborne virus. Does it make kids sicker, or does it make all of us sicker? I don't think we can say that for sure. I think it's, again, it's just so many kids are getting the virus that those who have fragile health or those that have immature immune systems they can struggle with this virus, sometimes need some help in the hospital temporarily.
Yeah, I think if you're a mom or dad or a family member, you're most concerned about making sure that your child is safe, right? And so much information is there in the public that you can begin to equate COVID symptoms, respiratory symptoms equal COVID, COVID positive equals hospitalization, hospitalization equals severe illness. And I think it's easy to see how those dots are connected, but what I'm hearing from you is that equation can certainly be true, but it's true in a very limited sense. Is that accurate?
I think that is accurate. And so if your child is diagnosed with COVID, it's not great. Nobody wants this virus. It causes a lot of problems in terms of symptoms while you have it, and sometimes symptoms later. But it is not equal to I need to be in the hospital.
So let's talk a little bit about capacity. There's been a lot of concern throughout the pandemic about our healthcare system, and does our healthcare system have the adequate capacity to do all the things that we do every day when we're trying to keep, in our case, children well, or bring about healing in cases where children are ill. And then you have COVID on top of that, right? And there's been the discussion of, do we as a community have capacity? And specifically, does Children's Hospital maintain the capacity to care for kids? How do we put that in context? How do we make sure that the public understands children's capacity to take care of their children?
Well, we're much busier than usual. This time of year is we're not expecting to see winter time volumes, but that's what we're seeing right now. We have capacity to take care of what's here, and the vast majority of it is certainly not COVID. We're having winter in August. Other viruses are out there in the community making kids sick. And so, yes, we are busier than usual, but we are able to take care of the needs of the patients that need us right now. We want to make sure you know that this is a safe place to be. When you need us, don't delay care. Come. We want to take care of you when you need us, and we're the place you want to be. This is a good time to remember where your sources of care are, and I think your first source is always going to be your pediatrician, pediatric office, and after hours when they're not available, but it doesn't seem to be an urgency or an emergency, then urgent care would be perfect, and then the emergency room if it looks like it's a true emergency. Our emergency room's busy, as all the emergency rooms in the city are right now. And we want the emergency room to be ready to take care of those sickest of patients. So if your needs are not as urgent, but you need some questions answered about your child's illness, then I think contacting your pediatrician, being seen at a pediatrician's office, or using one of the pediatric urgent care centers is ideal.
So if you're mom or dad, right, and you've now gotten the news that your child is COVID positive, or if you're concerned your child is at a high risk for getting COVID, what should you be thinking about?
Well, first let's talk about the illness. You want to make sure that your child is safe at home with the care measures that you have in place. So that primarily focuses on two things, Matt. It's, are they eating, but especially drinking enough to not get dehydrated? Because sometimes COVID symptoms are vomiting and diarrhea, and they lose appetite, can't retain fluids, they can get dehydrated. And that's one of the main reasons that kids get admitted to the hospital. The other is really focused on respiratory or breathing symptoms. How fast or hard are they breathing? They're almost certainly coughing, and they may be running some fever, but you want to watch that breathing and see how much work is involved, whether it's a baby who may be really retracting or it's an older child who is having to sit up to breathe and work harder to breathe. That's when you should be concerned and seek that higher level of care. So that's the illness itself. There are some patients out there who have high-risk medical conditions, whether that be breathing conditions, heart conditions, issues with their immune system or how they can fight infection, that if they're 12 or above, they are eligible to receive a very effective treatment. There are monoclonal antibodies that are specific against the Delta variant that you can receive by IV or injection, and they do a really great job of preventing progression of disease for those high-risk patients. So we want to prevent that. We want to keep them out of the hospital. We want to keep them out of intensive care. That is a great opportunity for the 12-year-olds and up. Additionally, after you've had COVID and you've recovered, there are sometimes symptoms that can linger that has prompted the American Academy of Pediatrics to encourage you to make a follow-up appointment after your 10-day isolation period is over to see your pediatrician, to see your primary care provider, discuss how your child is doing, and see if any other additional follow-up is necessary. And then finally, there is an inflammatory syndrome, multi-system inflammatory syndrome of children, MISC, or the initials, that we saw with previous surges. We started seeing that in November, December, and January, and continued to see it in the springtime. It follows COVID. We don't understand exactly why this occurs. It's not incredibly common, but there have been about 4,000 cases across the country. We've treated roughly 30 or so here in this area throughout the pandemic. But children get sick 3 to 4 weeks after they've had COVID, and they run fever. And then their symptoms can be very mixed. They quite often have belly pain. They may have vomiting. They may have a rash. They can have a lot of strange symptoms, but they feel really bad and they look sick, and they need medical attention as soon as possible. Good news about it is it's treatable. But the bad news is it needs to be recognized to be treated. So when COVID's over, a small number of kids are going to have trouble with this MISC, and parents need to be informed about it and know to seek care.
I think it's important for us to remember what our responsibility is, which is to make recommendations that are based upon the information we have, and to allow mom and dad to be mom and dad and to make the decisions for their children every day. So what fits into that category of playing offense to play defense against a virus?
We need to talk about vaccination. And vaccination is still only available for 12-year-olds and up. I think a lot of parents, a lot of us were sitting on the fence about when the age was lowered to 12, how safe is it? How important is it to protect my child? Because they may not get that sick with COVID anyway. So only about 30% of people have chosen to be vaccinated at 12 years old and up. In the age of this variant, I think it's a very different decision. I think that you want to be vaccinated because as contagious as this variant is, it's almost impossible to avoid this virus. If you don't have immunity against it, you're going to get it. And you don't want to get this. You may handle it just fine. I'm sure everybody knows people who have done just fine with it. But I bet everybody knows people who haven't. And we are seeing kids in the hospital that are sick with it. About half of the ones that we've admitted were old enough to vaccinate. And I want to mention that only to say, revisit that vaccination issue for those that are 12 and up. It has proven to be very safe, and it is a much safer choice to get the vaccine than to face the virus and take chances with what this virus can do. Now, not all cases are in the unvaccinated. Even if you've had the vaccine, you can get what is typically a mild case of this. But it reminds all of us why we've gone back to masking. You and I are a few feet apart. We're safe in a fairly open room to have a conversation. But indoor spaces where things are congested, I think you want to opt for masking. It's a choice. It's a choice in our area, but I think it's a safe choice to try to avoid getting this virus. Keeping a distance and hand washing also still important, but probably the single most important step is to use a mask barrier when you're in an environment where you're just too close to other people, especially other people that are not masked.
So as we summarize our time today, I hope that each of you have had a chance to listen and view what we've talked about, find the information helpful. Our goal was to try to condense and to wade through a lot of the complexity that's in the world today, where you are trying to figure out what information to digest and how to then take the appropriate actions based upon that information. But I also want to close with a few messages that I think are really important for us as Children's Hospital. Number one is, it's our desire, having this conversation with you today, to put as much information into your hands so that you can make the best decisions for your family, for your children. Number two, what I would tell you is, we take our responsibility of making sure that you, the public, have good information very seriously. That's why we want to sit down and share some of the information that we shared with you today. And we commit to doing that as we go forward, as this situation develops. Number three is, I hope you realize what a blessing it is. I certainly realize the blessing it is to have Children's Hospital in this community, to have people like Dr. Joe Childs, who've been engaged in this community for years, not just as our chief medical officer who does administrative tasks, but as a practicing pediatric intensive care physician who cares about you, who cares about this community. It's his community. It's my community. We want it to be a healthy community. So as we go along, we promise to give you additional updates. One of the things that you'll see from us on that dimension starting on Wednesday of this week is a dashboard that we'll put out via our social media channels that give you a situational update of what we're seeing at Children's Hospital so that you can make the best decisions for yourself and for your family. So as I close, thank you for tuning in. Thank you for giving us an opportunity to communicate directly to you. Thank you to our team who's doing an amazing job caring for not just patients who are suffering from COVID, but from patients who need us, who need the specialized care that only we can give in this environment. And I think thank you to you, our parents, our guardian, our community, who is entrusting us with the sacred responsibility of serving you. Thank you for trusting our team to care for you. Have a great day. We hope you find the information that we shared today with you useful, and thank you very much for caring about Children's Hospital and about our community.